Hi there, I'm Dr. Amber Belt with Sage Sirona and Aspen Integrative Medical Center, and today I'm going to be breaking down blood pressure. My goal today is to demystify blood pressure and empower you with some knowledge around hypertension. I'm going to be keeping it short today, but just so you know, I am going to be teaching a more detailed class in the near future about high blood pressure, where I take a deeper dive into some of the subjects we're just going to touch on today in this short video. If you're interested in taking the full class, make sure you keep in touch with me either on social media or through my newsletters. And in the video description that's below this video, I'll provide some links so that you can stay in touch if you want to. All right, so what I wanted to start with as far as blood pressure is concerned is, what do the numbers even mean? So what does it mean when you get told that your blood pressure is 120/80, 140/90? Like, what does 140 mean? What does 80 mean? Why is the top number the top and why is the bottom number the bottom? Those are questions that come up for folks. So I wanted to go over that. Blood pressure, in a nutshell, is the pressure. It's a measure of the pressure in your arteries, and we separate this pressure into two numbers: your systolic blood pressure and your diastolic blood pressure. Now, your systolic blood pressure is the top number of your blood pressure, and your systolic blood pressure is the amount of force or pressure that is that your heart exerts on the walls of your arteries while your heart is contracting or beating. Your diastolic blood pressure is the bottom number, and that number is the amount of pressure or force in your arteries while your heart is at rest or not beating. Now, the way that I initially remembered that systolic was on the top and diastolic was on the bottom was remembering that those two words are actually in reverse alphabetical order. And it might seem like a nerdy way to think, oh, D comes before S, so you would think diastolic would come before systolic. You flip it around and it's opposite. That might seem like a counterintuitive way to remember things, but it works for me, and I know it's worked for a lot of other people. So systolic's on the top, diastolic's on the bottom, and your systolic blood pressure is just inherently going to be a number that's more variable. Your systolic blood pressure is going to be more likely to fluctuate if you are stressed out, if you're nervous, if you're in pain, if you're angry. That top number is going to be the one that's more likely to go up higher. Your top number, your systolic blood pressure, if it's elevated, is generally more connected to heart disease. And as we age, our arteries become stiffer and less able to handle that pressure that your heart puts against the walls of those arteries when it beats. This stiffness can result in, or does result in, a gradual elevation of blood pressure as we age. So keeping those artery walls flexible is pretty important. Now, your bottom number, your diastolic blood pressure, should be the more stable of the two numbers because it's less likely to jump around if you get mad at somebody or if you hurt yourself, stub your toe, something like that. It's still very important to monitor that bottom number and to pay attention to it because we definitely don't want that number running too high either. Okay, so what I wanted to do next is break down some of the numbers so that you're aware of what the criteria actually are for hypertension, otherwise known as high blood pressure. Now, I'm going to rattle off these numbers, but don't worry. In the video description below, I'm going to provide you a link that you can just click on, and these numbers will pop up in a nice, beautiful chart that's color-coded and everything. So you don't have to scramble to write numbers down right now. I gotcha. So normal blood pressure is going to be less than 120/80. So your systolic should be less than 120. your diastolic should be less than 80 in order for your blood pressure to be considered normal. Now, pre-hypertension or elevated blood pressure is going to be a systolic of 120 to 129 and a diastolic of less than 80. Now, stage 1 hypertension is where your systolic is going to be anywhere from 130 to 139, and your diastolic is going to be anywhere from 80 to 89. Stage 2 hypertension is when your top number, your systolic pressure, is greater than 140, and your bottom number is greater than 90. So systolic greater than 140, diastolic greater than 90 is stage 2 blood pressure. Now, a hypertensive crisis is when your systolic or your top number is greater than 180 and your bottom number or your diastolic is greater than 120. If you have a blood pressure of greater than 180 over 120, you need to seek medical help immediately. And it's also interesting to note that almost half of Americans right now meet the criteria for some level of hypertension, high blood pressure. So that's a lot of us. And so I think it's important that we kind of know as much as we can about it so we can get underneath it and, get healthier hearts. Okay, so now I thought you might be wondering, why does it even matter if my blood pressure is high? Now, one of the reasons that people tend to let their blood pressure slide is because when you have high blood pressure, you don't really feel it. So you may or may not already know that hypertension is called a silent killer, because generally people don't feel symptoms unless it's a really big problem. And when you start to feel symptoms from your high blood pressure, a lot of times it's not a good thing. It's important to monitor your blood pressure at home because there's a whole host of issues that can happen if your blood pressure is chronically elevated. Okay, these issues are stroke, heart attack, heart failure, vision problems and vision loss, kidney failure, erectile dysfunction, and aneurysm. None of these are outcomes that we would want in our health at all. So making sure you keep your blood pressure in a healthy place is going to some degree help you avoid some of those big nasty things I just talked about. So now let's talk about who is at higher risk for high blood pressure. And there's another kind of laundry list of people who are at risk for higher blood pressure. And, a lot of people hit more than one category. So if you're overweight or obese, you're at higher risk of hypertension. If you have a close family member who has high blood pressure, you're at greater risk for high blood pressure. African Americans are at higher risk for high blood pressure. People who don't exercise, people with kidney disease are at higher risk for high blood pressure. And kidney function is one of those things that's really, really easy to check when you get your yearly blood work done. So make sure you're doing that. It's so easy to check on so many of these health things just by getting your annual labs done. So if you've been slacking off on doing that, go get that done. If you're a smoker, you're at higher risk for high blood pressure, as well as if you're an unhealthy eater. A lot of people buy a lot of heavily wrapped in plastic stuff at the grocery store, and those foods aren't generally what we would be what we consider healthy. Drinkers, people who drink more than about 1 or 2 drinks a week are going to be at higher risk of high blood pressure, and people who are under chronic stress are at higher risk of high blood pressure. And I know, this probably doesn't apply to you, certainly doesn't apply to me. No one's under chronic stress right now, right? Sure. Okay, so let's talk about treatments briefly. Now, as far as treating high blood pressure goes, lifestyle should absolutely be the first intervention. I don't care if we're talking about a medication. I don't care if we're talking about a supplement. Nothing works as well if you don't have the lifestyle pieces in place. So you can't out supplement or out medicate a crappy diet or crappy lifestyle. So get that in order. It's important. It's work, but it's good, important work. So as far as lifestyle issues are concerned, because so many people are overweight or obese, healthy weight loss should be a focus for a lot of folks. Exercise is another thing that we're going to want to focus on as far as lifestyle is concerned to help correct high blood pressure. And I am a big proponent of consulting with a personal trainer or a physical therapist if you are just getting started on an exercise program, or if you are doing an exercise program and you want to make sure it's a good road to go down. You know, these folks who are trained in exercise prescription can help you make sure you're not doing too little exercise. They can help you make sure you're not doing too much exercise, and they can help you with your form so that you don't get hurt. Because if you're just starting an exercise program and you screw up your knee or your low back, it's really hard to continue. So just consulting at least a couple of times with a trainer is something I'm a big fan of. Okay, stress reduction. This is a big one. I think people like to talk about what we can add into our lives to bring our stress down. But first, I want to talk about what can we remove to reduce our stress. And things, some top things to remove or at least cut down on to reduce your stress would be your media time. I tell patients very regularly to do a media fast because social media and news media are both big sources of stress for people. And news media, it's designed to keep you scrolling and to keep your fight or flight reaction triggered. So taking a break from that can reduce your stress, and then that can help reduce your blood pressure. As much as you can, reducing your contact or cutting off contact with people who provide a lot of stress in your life is a good idea. And also work stress. I think it's important to have a lot of boundaries around your work. It's something that I deal with a lot in my work. But if you can find ways to leave your work behind and not be answering emails at midnight when you're just going to be back at work in 8 hours anyways, is a really good boundary to have to reduce your stress. Now, things that you can add to reduce your stress, one would be nature time. Nature is amazingly healing, and most of us don't spend enough time in nature. Adding in exercise as a source of stress reduction is fantastic, and it multitasks, right? Like it keeps our vessels healthy and it reduces stress, so win-win. Healthy socialization is important for a lot of us, particularly if you are, if you're an extroverted person who kind of feeds off of those big crowds. Healthy socialization can be very important. And a lot of people reduce their stress through meditation or prayer. So those are some things you can add in. But sometimes if your life is super busy, it's easier to think about taking things away than it is about adding things. Okay, dietary changes. More real foods, less processed foods. More foods that look like they did when they came from the farm. Pro tip, a farmer's market is a really good place to get things, to get foods that look like they looked when they came from the farm. Less packaged and processed foods. I'll dive into more dietary detail and into more detail of all of these lifestyle things in my class. I could go on for a while here. And a lot of people do better diet-wise if they can have a dietary plan to stick to. So, some people like a low-carb Mediterranean diet. Some people like a paleo diet. I really like when people can find a diet that works for them, if that diet focuses on real food. I'm a big fan of eating real food and not a lot of processed bars and stuff. Okay, so another lifestyle thing that's great for blood pressure is hydration. And many people miss the boat on hydration. I drank 2 8-ounces of water today. Oh my gosh, that's not hydrated. So I want to teach you that the baseline formula that I use for my patients for hydration is taking half their body weight, dividing that number in half, and that number is the minimum amount of water in ounces that they should be drinking a day. So let's say my patient weighs 150 pounds. I divide 150 in half. That gives me 75. So my patient's baseline hydration is going to be 75 ounces of water per day. Now, it can be water. It can also be other fluids. So water, herbal tea, electrolyte drinks, those are all fine. What does not count as hydration would be caffeinated beverages and booze. Those things actually cause you to lose more fluid, and so they actually work against you optimally hydrating yourself. Now, in that example that I used for my patient, 75 ounces of water is their baseline hydration. If they sweat a lot, if they drink caffeine, if they drink alcohol, if they do anything that's going to make them lose fluid, they need to add water on top of that 75 ounces. So keep that in mind. The other thing that I think people miss out on is they drink water all day and they forget to include electrolytes. And electrolytes are things like potassium, sodium, chloride, magnesium. And I like to have patients include electrolytes at least twice a day. There's a lot of electrolyte mixes out there, electrolyte tablets, things like that. I really like RE-Lyte by Redmond Real Salt, and I'll put a link so you can check RE-Lyte out in the video description. Okay, last lifestyle thing. Check into sleep apnea. So since a lot of people who have hypertension are overweight or obese, that lends itself to sleep apnea. So, and then sleep apnea also lends itself to high blood pressure. So if you've ever been told that you snore or that you stop breathing when you sleep, you might want to check into whether or not you have sleep apnea. People who have sleep apnea will sort of classically wake up in the morning and feel completely exhausted. I even know of people who have had sleep apnea so bad that they're falling asleep at the wheel of their car, just on an average day. So that's definitely something to make sure that you make sure is addressed if it's happening for you, because it will, it does contribute to high blood pressure. Okay, medications. Let's talk about meds. Now, 2 of the top 5 prescription drugs that are prescribed in the U.S. right now are drugs for high blood pressure. And considering before that I said that half of U.S. citizens meet some criteria for high blood pressure, it's really not a surprise that so many medications that are prescribed are for high blood pressure. There are multiple medications for blood pressure. There's lisinopril, there's amlodipine, there's atenolol, there's hydrochlorothiazide, there's a bunch of them out there, and there's a bunch of different categories, and they all work a little bit different with our physiology. Now, blood pressure medications are effective, but they're not risk-free. And what I want to do in my blood pressure class, my longer class where I'll dive in deeper, I want to go over the categories of blood pressure medication, some of their common side effects, and then some of the common nutrient deficiencies that those medications might cause. So stay tuned for that class if that interests you. All right, and last but not least, intervention-wise, would be herbs and nutrients. Herbs and nutrients can be very effective to help people manage their blood pressure. But just like with the medications, nothing is going to work as well if those lifestyle pieces aren't in place. And there's certainly nutrients like magnesium. That's a really well-known one that people will use in order to keep their blood pressure in check. And then there are a ton of herbs out there that can work very well. If you decide to go down the road of herbal medicine to treat your blood pressure, my advice to you would be to work with someone who knows what they're doing with these herbs. herbs can be very powerful and do a very good job, but some of the herbs that we use for blood pressure come with their own set of side effects. So you just need to be working with somebody who knows how to help you watch out for those side effects. And again, I'll go into a lot more detail in my blood pressure class about what herbs and nutrients that I've used over my 15 years of practice to help my patients successfully manage their blood pressure. Okay, so that kind of wraps it up for right now. I hope this video has helped you feel empowered about your blood pressure, help you feel empowered to know why we monitor it and why it's important to keep it in a healthy range. And once again, if you're interested in my full blood pressure class, keep in touch with me via social media or via my newsletters. I send out some pretty good newsletters, so if you want to sign up for those, I would definitely recommend it. But however you want to keep in touch, just check the description of the video below, and I'll put some links in there so you can keep in touch. All right, that's it for today, and I hope you stay healthy. Bye.